Okay, we're back. We're going to test out the ankle with active range of motion, overpressure, resisted, joint play, and then palpation. So for the camera to see this, best would be in this position. You can do this clinically this way if you choose to. I do recommend that it's probably better to do on the table, but if you're comfortable this way, you can do it this way as well. So what I'm going to have Fatty do is I'm going to have Fatty do dorsiflexion, and I'm going to do overpressure right there. Good. And then plantar flexion. Great, I'm going to do overpressure right there. Now we can do inversion. Great, I'm going to do overpressure right at that point there, and eversion. Great, I'm going to do overpressure right there. Great, so I've got the major movements of the foot. So from there, what I like to do is resisted testing. So simply, I'm going to push down in this direction. You just resist my movement. Ready? 1, 2, 3, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. Great, so now I'm going to go in the other direction. Ready? 1, 2, 3, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. So I'm going to try to move your foot in this direction. You resist my movement. Ready? Good. 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. And the last one is inversion or eversion. Ready? 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, relax. And 1, 2, 3, 4, 5, and relax. Great. So we've done active range of motion, overpressure, resisted. Now we're going to do some joint play and then some palpation of this region. So joint play, we're going to do the talocrural. And McGee's would call it the anterior and posterior drawer test for the ankle. So first of all, I'm going to stabilize. I've got my hand over the medial lateral malleolus to stabilize with my leg. And I'm going to do a posterior glide, and I'm looking for movement and feel. Any kind of discomfort there at all? You haven't injured this too, have you? No? Good, good. And then, not recently, an anterior draw, anterior glide, looking for any kind of movement or sensation or feeling or discomfort by the client. And once I've checked that out, I can go to the tarsals. And what I'm going to do is what's called a superior or inferior glide on the tarsals, the navicular, cuboid, cuneiforms in that region. Okay, and I'm going to do a inferior glide, feeling for any kind of discomfort, looking for any kind of movement, and again superior. Great. You can also, depending on the area that you're looking at, you can also go to the toe, great toe, the tarsal phalangeal. And you can do anterior and posterior glides in those as well. They're quite easily done. So for palpation, I can palpate the intrinsic muscles of the foot. I can palpate the bottom of the foot for, different irritations and pain and temperature and texture and tone. One of the common things is plantar fasciitis. It's often found here. Again, I'll palpate the tibialis anterior and the peroneal muscles, the gastrocnemius soleus. I can palpate, and I'm palpating in this position just more for the camera than anything else. I would probably have the person in a prone position on the table, palpating this region more specifically. Okay, so we've done the whole area, and so now you can go to Blackboard and answer the following questions.